Hello, my name is Jennifer Manuel, and our facilitation today is going to be about euthanasia. Currently, it's a controversial topic that's just ongoing debate for many years. And based on the article that I used, the author proposes that legalizing euthanasia would cause many future problems, and if it would cause problems if it were to be legalized in all 50 states. But currently, there are 9 states that have legalized not euthanasia, but physician-assisted suicide. And so those two are slightly different. And there are other countries in the world, such as like Canada, Belgium, the Netherlands, Colombia, and Switzerland, who've legalized euthanasia. And so, and in this talk, I like to explain like the difference between euthanasia and physician-assisted dying, and then after that, I'd like to explain the pros and cons of euthanasia, and then after that, I'll ask some questions in the end. So there's no right or wrong answer, but you are free to answer them openly. All right, let's get it on. So euthanasia specifically is when a physician takes an active role in injecting a lethal drug into a patient that requests to be euthanized. And physician-assisted dying, not suicide, but dying or aid in dying or death with dignity is a type of medical practice where a physician or doctor provides the lethal choices for a patient to make in order for them to be euthanized. And for physician-assisted dying, the patient is able to request the time and day that they want to be euthanized. And although they're both different, they're used the terms are interchangeable for some reason, but for the sake of this talk, they're gonna be similar in similar ways. And so now that I've established the difference between euthanasia and physician suicide, with every controversial topic there comes with pros and cons arguments. And so I like to first start with the pro arguments. And the pro arguments for euthanasia are that if we were to legalize euthanasia, we would be able to respect a patient's personal choice and how they want to die. And also legalizing euthanasia would be is a part of a doctor's job, right? Because they take care of the patient and they're putting their best interest in the patient. And the last argument for euthanasia is that having that option to be euthanized is comforting for some people, because the concept of dying is very scary and they don't know what to do. And so having that option is kind of reassures them that it's in their hands to take care of it. And so on the other hand, there are arguments against euthanasia, and those are that if we were to legalize euthanasia, it would cause problems such as people would see suicide as okay, and that would increase suicide deaths. Another argument is that people say that euthanasia is not a part of a physician's role in healing, because as they're heal the sick. And then lastly, if we were to legalize euthanasia, an argument against that would be it would like put patients in a position, like in a gray area where people like a terminally ill patient will feel like, oh, they don't really want to die, but they feel the need to choose to be euthanized because, you know, for their family's sake, they don't want their family to worry too much. And that's it pretty much. Yes. And so is there any questions is there any things that you'd like me to clarify for you?
No.
No?
I think I'm okay. Yeah.
Alright, that's good. So now that we talked about like euthanasia, like the difference between with physician suicide and the pros and cons about it, how does euthanasia or physician assisted suicide make you feel?
Honestly, I don't really have like an opinion about it. I do feel like that option should be between the patient, like the patient's family, like them, and then also between the physician, because one of the cons, it was saying like that like it's not right for the physician to take part in that because it's like not healing. But at the same time, like the physician's job is to take care of the needs of the patient. So it's kind of like it's like it's still too hard to think, like, to talk about. But I personally, I think that it's like it depends. Like it depends on the person.
You know, I totally agree with you on that, and I could see like how that would cause problems for some people. And like if we were to be legalized in all the 50 states in the United States, what kind of other problems would arise from that?
I think that like just a lot of like people would be the people who don't believe in it would be a little like enraged, you know, like there's gonna be like some outrage or like some feedback, but it's kind of like the more it's known, like it's it's like the less effective it'll be. And then like it's like planting a new seed too. Like it takes time for it to grow. So like now, if let's say it's implemented like now or soon, like it's gonna receive some feedback, and then eventually it'll just kind of, you know, be whatever, a thing in the past. I think.
I see how like that can be it, because there's always gonna be people against it, and like there's gonna be like an outlash or like a response for it. So yeah, thank you for that. And then last but not least, how does the option, what kind of skills or resources are we missing to like understand like a patient's decision for to be euthanized, and how do you think we can get those resources?
I feel like we're never really gonna have enough resources, or like the correct resources, because it varies from person to person. Like each patient has different reasons for being euthanized. Like an older patient with like no family left would probably want to be euthanized, or like think to just move on. And then another thing, like resources too, like if a terminal ill person like does not want to burden their family, then like they'd want to be euthanized. So basically what I'm trying to say is like we won't really have enough resources to know, because like everyone is different, and each person, like their what they decide and what they are thinking is different, so it's kind of hard.
Yeah, that I agree with you on that as too. And you know, when it comes to death, like people are very like they don't know like how to deal with that, or like to understand their feelings about that. And so, you know, I just feel like we need a more stronger understanding of like our own feelings, and like accepting that death there's no right way to like
Mhm.
accept death and how to go about it, and ultimately we need each other in the end.
Yes.
Yes. So well, thank you for participating in my talk today. I really appreciate your responses
You're
and your attention, and thank you so much. So.
welcome.